Good deal. Thank you for the January showing up for the January 2021 Fireside Chat with our Rotary District 5790. This is an exciting chat that we're going to have tonight. We've got a couple of great guests, but first of all, I wanted to remind everybody that January is Vocational Service Month for Rotary. So remember that as we're doing things, and mention that to your club and mention that to your other club members that it's Vocational Service Month, and what can you do to help support that. The Chris Castro will be sending out our district treasurer in the next couple of a few days, the second half of the district dues. These are calculated based upon, we split it in half this year. So half were in July and this half is in January. And that's based upon your membership and how many members you had as of December 31st. Remember that we do have the Paul Harris Funds matching funds. That is going on to the end of this month. And we really encourage you to encourage people in your club to become a Paul Harris Fellow or to become a sustaining Paul Harris Fellow. Our minimum is $250. And for that, you get $500 towards your Paul Harris. We match that $250 1-to-1. And if you do 500, you become a Paul Harris Fellow. So we really encourage you to do that. Send an email out to all the club presidents and the directors this Monday, and it's the second or third email in that series. But we are looking for district governor nominees to follow Dan. I've been a little confused on the years on those emails, but we'll try to get that down where they have the right years in there. But it'll be following Dan, and that should be. And Pat can correct me if I'm incorrect here, but 22-23. Yeah, 22-23. So nope, 23-24. 20. Thank you, Pat. So that's why I have Pat around. She cleans up my mess as I go along, unless it's already gone out, and then she goes, "Yeah, Roger." So to qualify to be a nominee or qualify to be in the interview section, you need to be one of your members or yourself need to be a past president of the club, of course, a Rotarian in good standing, which means that you're a current Rotarian and held a district position for at least a year. So if you want to be district governor one day and you have been president but you haven't held a district position, you need to reach out to myself, Janelle Kavanaugh, Pat Peters, or Kayla Christensen, which is the incoming, or Dan Steele. And we can sure, there's about 50 spots that we have within the district that are district positions. And we would love to have you involved. There's a lot of fun, a lot of rewards. It's not a lot of work, unless you're the treasurer, and then I guess it's a lot of work there. But other than that, and I don't think it's so bad, but Chris can tell us later if it is. But we really look for some good quality. We have some incredible people in the district, and a lot of you are on tonight. So we would love to see you involved more in the district, making a lot of changes in people's lives. We have pets coming up at the end of February. So all the clubs need to make sure you have your president-elects that are in the system in Rotary Club Central as your or in the district website as your president-elect, and also your president nominees that we have out there. So we would really encourage you to do that. And also your president-elects do need to register for pets. The registration is on the district website, and all the presidents and president-elects, if they're in the system, they've received multiple emails on that. So we need to make sure it's all going to be virtual this year. It's going to be the first time that's ever been done. We normally do it at DFW Airport. We normally have about 800 in attendance. So it's going to be exciting to see how well this plays out. I think it's going to do great. We've got a great planning committee behind that, and I'm excited to see everybody on there. Also, if you in your clubs, you need to ask the president-elects to go ahead and start signing their board members and getting their board members. And in place for July and in the system. And once they're in the system, they'll get they're not going to get bombarded, but they're going to get email here and there from Rotary International, just helping them with that position, whatever it may be within the club. Review your goals in Rotary Club Central. I'm asking all the presidents to do that. So make sure you're reviewing your goals in there. And four-way speech contest is this month, or in February. So your clubs need to be working on that and doing the four-way speech. Lori, Janelle, help me out here. Unmute yourself.
Lori Richardson from Kennedale.
And reach out to Lori Richardson from Kennedale. We do a club version of that, and then your club selects somebody. Then it goes to a regional. We have 3 to 4 regions, depending on how many clubs are involved within our district. And then we have the district four-way speech contest. So kiddos can get a little bit of money for that. It's a great learning experience for them. It's a lot of fun. So we really encourage all the clubs to be involved in that and reach out to Lori. I guess Lori's going to reach out to everybody in the district, or already has, and put that in place next month. Four-way speech contest. District website has a ton of resources. Really encourage you to go in there. John Picorni has done a fantastic job on putting information in there and making sure that everything in there is easy and attainable. So we really encourage you to do that. And with that, I am excited to bring on Gerald Robinson, past district governor. He and a team have been working together on COVID relief. Now, we are Rotarians. We are not first responders. We don't dig through rubble after a situation, but we do come in once the first responders are kind of done with their stuff. So we come in with relief on other areas. And Gerald, you have the floor. I'm very excited to have you on here and to get some updates on what's going on with COVID relief.
Thank you, Roger. I noticed on the agenda I was a PSG. I was trying to figure out what the S stood for. Hopefully it was something positive. Thank you for having me tonight. Andy Eads at the last meeting that Roger had, the last Fireside Chat, talked about COVID, and he made some comments regarding COVID and what it's going to take to get that to happen, and how we as Rotarians are put service above self, what we do and how we approach what we want to accomplish. And we came out of that, and I talked to Roger about trying to put together a Denton County approach, since Andy is over all of Denton County as the county judge, and therefore the Denton County Public Health Department. So that's what we've done, and we're kind of focusing on 3 things that we're working on that. And the next slide. Oops, you passed one. You went so fast there. Yeah, it's Rotary updates, getting Rotary involved, because as an organization, we're service above self. We're the world's greatest humanitarian organization. COVID is unlike anything we've faced in our lifetimes. So we feel that it has to be involved, and we decided to get involved in Denton County. I do know from a RI level, there's a special task force of 6 people that are getting together to decide expand Rotary's role in trying to defeat COVID. John, just keep clicking there. So that's my buddy Paul Harris on the right. And one of my favorite quotes from him, he said in 1912, is Rotarians are very much more favorably disposed toward action than they are toward words. So that's what we're trying to do here in Denton County, is get things going with that. We've got a story to tell. When you talk about our involvement of over 30 years with trying to end polio, we Rotarians, for the most part, believe that vaccines are important. Vaccines can change the world, and it's certainly something we're going to have to do in Rotary. John, the next one. They work. The fight to end polio is our proof. That's what we're trying to accomplish. and the name of the game is going to be getting shots in arms. I was in a Zoom meeting today, and we have over 900,000 people in Denton County. And because it's going to take 2 shots, if we were to do 100% of the population of Denton County, that'd be over 1,800,000 shots in arms. And I found this Rotarian picture there, and I thought it was there. One of our first things is trying to publicize our belief in the importance of vaccines, using Facebook, Twitter, in polio now through the with Club Runner, any other ways we're doing, and we're putting together a committee of the clubs in Denton County to work on this, and we're coming up with some other ideas. We haven't even had our first committee meeting, but Roger wanted me to go ahead and talk about this as we go forward. The Denton County Public Health Department will be coordinating all this. I signed up on their sheet a few days ago, and I'm waiting on to find out when my wife and I might be able to get our first vaccines. I have some friends that were in the first wave today, but we're gonna be coordinating with them on what we do, and try and publicize that as much as we can. Second thing we're going to do is work. This was last week's 0 vaccine shipment. They had 0 last week. They got 3,000 this week. Supposedly they're getting 10,000 the following week. So it's beginning to wrap up. In my opinion, there's going to be 3 phases of this, trying to make it work. We're in the first phase right now, where you're dealing with healthcare professionals and people over 65 or individuals that have underlying conditions. And as you all probably aware, we're kind of stumbling through that, not only in Denton County, but in Texas and the rest of the nation. And some of those things will work out themselves. But John, you're getting ahead of me, but slow down a little bit. We're sitting there trying to focus on what we're going to do and how we can be involved. And one of the ways we feel we can be involved is providing support, because there's going to be mass inoculations, drive-throughs. That's kind of the approach that we're looking at right now. 4 to 6 locations with multiple things. But if you're going to put them, over 1 million shots in people's arms in Denton County to get it up to, where you've got at least 60% of the people that populace have been doing that, it's going to take a lot of work and a lot of effort. So we're getting together on what we're going to do is, as far as volunteer services, whether it's guiding cars through as they go through the drive-through, whether it's the Lake Ray Roberts Club reaching out and driving the 90-year-old lady that lives in Pilot Point to a site to be able to do that and getting her back. Which you'll be hearing more about that as the committee starts meeting next week. We do have 12 clubs and a satellite club in Denton County, so we're well positioned all over the county to be able to provide support. So we're very excited about that's going to happen with that. We'll be using a volunteer sheet, sign-up sheet that'll be done through the internet, and be able to provide, various clubs will be focusing on various things, trying to do that. As I said, it'll be mass inoculations. Denton County has not made the decision yet to go to a large-scale facility and do it inside the facility, but that may well have to happen. Again, if you're going to get 1 million shots in people's arms, you're going to have to come up with other ideas. Right now, the initial focus is going to be on multiple drive-throughs, multiple days a week. John? This ties right in with our vision. Together we see a world where people unite and take action to create lasting change across the globe, in our communities and in ourselves. And I think we can feel good as Rotarians about being able to make a difference, to go out and try and make things happen. And certainly if we can be a part of helping end COVID, that's what you would call lasting change. And that's what our goal is, John. Together we can end COVID, because we're people of action. Now, the third prong of this program, it's not this one, but this was just a slide I took off of something that Denton County clubs did earlier in trying to assist back in the early part of the COVID-19 to reach out to people who'd lost their jobs and everything that was going on with that. We've asked the clubs to consider asking people who may be getting stimulus checks that really may not need that stimulus checks to donate it back to the club, and then the club reach out to whatever organization, whether that's served in Denton, CCA, Lake City's place to give food out, but reaching out to try and help provide so many people that are hurting in it. And that's kind of the third phase of what we're trying to do. John? But it's time for action. You know, we've been kind of laid up here. My club was, since late March, was virtual. We tried to go live in early June, and that lasted 3 weeks before somebody contracted COVID, and we've been virtual ever since. We've done some projects around just to try and keep things going. But this is a way we can get out and actually become people of action and take steps to do that. John,
No.
together we save lives to end COVID now. We're going to come up with something like that.
Hey,
To go
with that,
do it.
yeah.
Dwayne's talking on the, there, Dwayne. Okay, the next one. Last slide. There's my buddy Paul Harris. I got to meet him when I went up to the RI headquarters, and give you one of my another one of my favorite quotes that he said in 1921. The only way anyone can prove his love of his fellow man is through service to his fellow man. And that's what we're striving to do in Denton County, and striving to reach out and help the county end COVID.
Hey, Gerald, question is, how can clubs get involved? I know you said your planning starts next week, but what can we do to set up something for individual clubs to get involved in their counties and to get?
That's Roger. That's going to be. I've got my hands full trying to help Denton County. I would suggest that you're going to have somebody that's going to be kind of a spiritual, make it happen. Reach out and find somebody to take charge. I sent a letter to all the presidents of Denton County. Over half of them have got back with me so far and telling me, yes, they want to be a part of it, and they told me who is going to be assigned to their committee. I know Cross Timbers has 8 people that are on their committee that are going to be working with it. But I'm still waiting. The deadline for that's not till Friday to even get back with me. So hopefully every club in Denton County will get involved. I don't know if I answered your question properly.
Well, what kind of time frame are you talking about? I'd like to see the other clubs piggyback on what you're doing. So what kind of time frame are you looking at?
Well, I hope to have my first committee meeting. Andy and I will early next week, once we know who the committee members are. A lot of it's going to be driven by them. You know, we've got our 3 parameters that we kind of built this program around. They may want to expand what happens with that. The volunteer efforts will start coming soon as the county starts getting more doses. Naturally, when they've only got 3,000 doses, they don't need as much help as they will when they start getting 20, 25, 30,000 doses in a week. Those things are going to happen. As I said before, I think we're going to be much more involved in the phase 2 and phase 3. Phase 2 is people that want it, that haven't gotten it yet. And phase 3 will be the ones that are kind of maybe a little resistant to getting the vaccine. That's why the first phase of what we're trying to do is publicize exactly what it is. Like when I get my shot, I'm going to have a picture taken of it. It'll be on Facebook. It'll be on our club's website. We'll be talking about the importance of vaccine and how Rotary supports vaccinations.
What is the main goal of that committee that you're having in Denton County as far as what are you looking at doing? Is providing transportation, providing, who to reach out to?
We'll be providing some transportation to some elderly people. We'll be working with the Denton County Transportation. They'll pick up a lot of those people, but if you've got somebody in Justin or Pilot Point or some of the outlying areas in the county where there's no public transportation available, then we'll try and have a Rotarian actually go arrange for them to pick them up and drive them in, get them through the drive-through shot and take them back. But that's actually kind of a minor part. The major part of what we'll be doing is assisting at the drive-throughs, is people guiding and doing things of that nature. I don't know, Roger, if you've ever been to have your test, a COVID test at a drive-through, but it requires a heck of a lot of people to keep the cars flowing, to keep everything going, besides the people that are actually taking the test. Naturally, some of our Rotarians that are retired physicians or nurses or medical people, they could actually sign up to be part of the vaccination team themselves.
Very good. And we will keep the district informed on what kind of plans they're doing up there in Denton County. And I'm hoping that we can replicate that for all the other clubs in the district or all the other clubs that can be involved. Because I think that's who we are as Rotarians. We're out there to provide service to our community. And we need to make sure everybody has access to the vaccination that wants the vaccination. So that will help tremendously, and I'm excited about that. And on this, we're going to have John Purdue up next with the talking about Carter Blood Care. But if you have any questions on this, please put them in the chat. Right now, John, have you had anything in the chat that you've seen?
Nothing other than just general comments.
Okay. Okay. So if you have any questions, put it in the chat, as John said at the beginning of this, or you can stay on after this, and we'll ask Gerald and John both to stay on for a couple of minutes to answer any questions that you may have. But I think this is really something that we can get a part of in our individual clubs throughout the district. So Gerald, thank you so much for coming on board and having this done. And now I want to introduce John Purdue. John Purdue is past president of the Fort Worth South Club. He is also our blood vampire chair this year for our blood drives throughout our district. And he is on the board of Carter Blood Care. So John is put together a very extensive PowerPoint that we were talking about earlier today that he's going to have asked John Courtney to put on our district website so you have access to it. But our next phase on this is blood is needed, direly needed in the world, but in our district, in our area. So we're asking for blood drives and we're asking for plasma drives. So John Purdue, you have the floor.
All right. Thanks so much. And I guess I'll do the same thing, John Picorni, if I can cue you on the changes. Appreciate your help. And yeah, as Roger started into and very much aligned with what Gerald just shared, it's great that we have a focus this month on COVID. Unfortunately, it's we're already into the thick of a major surge in Texas and especially in North Texas. Thankfully, you have better than a lot of Texas communities to thrive, and just tying that in with our Rotary calling or mission is, it's very much a very simple gift. Everyone that I know has plasma and blood, it's a challenge because there's limited ability. And I thought we'd start with, so this is a twofold presentation just on passing this out to clubs. I'm going to go through fairly quickly. There's a lot of detail in the PowerPoint, so I apologize for that. It's more information than it is presentation. However, it's important that this will be on the district website. So y'all who have your club presidents on the call here, it's important blood drive program that you have someone who's going to be able to kind of lead the charge here and participate in some of these calls and talk with the local coordinators at your blood centers, and we'll go into that in a minute. Mainly because we've got a serious problem on our hands. The plasma, and my doctor included, kind of told me, I said, what was the main thing that you would that you've seen with this COVID? And this is a couple months ago. And he said, yeah, honestly, when my patients get critical, the one thing that turns the corner, and I've had firsthand experience with friends and clients that I've worked with who've gotten to the ICU stage, unfortunately, and is that they're able to get the plasma donation. And from that, someone who has antibodies, who's already had COVID, unfortunately, myself included. And so when you have had COVID, the plasma in your, with the antibodies, carries antibodies, is able to be donated every 14 days after you've been clear of COVID for a couple of weeks. So all the local blood centers are working on it. American Red Cross, being a global organization, has limited, but still, work with your local coordinator if you've already had a blood drive. But we've got a major shortage because, just talking about the situation right now, and stay on this slide for just a minute, we're back to where we're definitely have more people, like Gerald was talking about, more people getting the virus or having struggles with it than are getting vaccinated. Right now, we've only got about 800,000 vaccines across the whole state of Texas. And demand for this plasma, according to the Carter Blood Care team today, is that it went from 40 units a day demand by hospitals for these ICU patients to 600 units a day. So that's a 1,300% demand spike. So basically, we've got the cases of people that are critical that need this antibody treatment is really going up. So what we're trying to do at this point is educate and really get the word out, because it's not going to be just Rotarians. It's going to be your communities and your grandkids and your children who've already had the virus that are even eligible to do this. So with that, if I can go to the next slide. So Carter Blood Care, OBI, and in Abilene, I didn't have their information. Meek Blood Centers is providing donations of plasma, and it's basically the same thing as giving blood, but they'll return the blood to you after your plasma is donated. So I want to address a major issue here, and my main points here are that, number one, it is safe to donate. These blood centers are very careful, obviously, with their regulation and their sanitation and their appointment scheduling, and we need to let people know that, as we as Rotarians are probably educated to some degree, but those who we're talking to in our communities may not be, and may be afraid to go out and donate blood. Which brings me, to the second part, which unfortunately, the plasma day to the, we're now able to collect 300 units a day here in DFW with Carter. The ICUs are having no choice but to give it to their only sickest patients. And but the second part of that is that blood drives have also stopped. So blood drives are obviously critical, but because high school population supplies about 30% of the blood supply, and those drives have been put on hold or not allowed because of the situation we're in, and many students are virtual right now, including a couple of my kids. There aren't blood drives going on in high school, so we're short on that, and then we have the winter flu season and other things that go on. So my last bullet here, even though plasma is more urgent for saving lives, as Rotarians, we've always been great about blood donation, and we're down to where the local blood supply here, typically 1,000 units on the shelf, is now down to 100 inventory. Next slide, please. Can you hear me?
We're losing you,
To
John.
the next one.
I can't hear anything.
Okay, John's having a little bit of difficulty here, but so this slide program is going to be, we just lost John. Okay, this slide program is going to be available on our district website. There's a lot of great information in here. There's also a Word document that is associated with this. John, did he send that too, or?
Yes.
But
In
it
fact,
gives you. Say that
let
again, John?
me, is John back on?
No.
Okay, well, I'm gonna kind of slow. These are the blood centers here that he was gonna go over. But these, well, they're the major ones. There's a whole bunch more than that. But what he also gave us was, here's the site on our website. In fact, if you, let me see if I can make this work. This is the site on our website.
Can you hear me now?
Yeah, we got
Well,
you.
I can now. And scroll down a little bit there, and you're going to see this is John's pleasant presentation here. And one of the things that John was going to talk about was the knowing what your code is, so that by club you can kind of have some competition, if you will. And there's lists here that you can get there that tells you what your club's code is, and you can see how many people that you're getting to give the plasma. John, are you ready to go back on, and I can get out of these screens and put you back in place? Apparently not.
Yeah, he's on. He just froze up.
Okay. Thank God for the internet. Oh, well.
Okay. So with the blood drive, we really encourage you to reach out to your family, your friends, your clubs, work with getting people, as what Gerald's going to do, put together a deal for getting people to their vaccinations. We need to get people to give blood. We need to get people to the blood centers. My understanding is, John, are you back on? John Purdue?
Yeah, if you can hear me.
Yeah, we can hear you now.
Yeah, we can hear you now. You want me to go back?
Okay, so emphasis. No, this is good. I'm sorry about the connection issues. So let's keep it on this slide, because really it's January. If we can really focus on getting our word out, we probably will begin to save lives immediately. And the way to do that is to get your blood drive chairman, or even just your president, to get the word out via email, via your club meetings. Make an announcement every week in the month of January, and I would say into February, because we aren't vaccinating fast enough. And clearly there are some of us who have been really affected by this. So the way to work, obviously we're not first responders, we're second and third, like as Roger introduced. And just to kind of close on that note, be there for our communities by spreading the word about how this COVID plasma can be donated. And it's very simple. It's like scheduling a blood appointment. And those who are regular blood donors who are eligible, or even just letting people know that there's a shortage right now. There's a major shortage, and talking to the blood centers here in it's not a joke. I mean, we're definitely down on our blood supply, and this plasma that is, again, a last resort for medical hospitals that are receiving about half of what they're asking the blood centers for. In Meek and Abilene, and I know in Texas Blood Institute in which Falls, you can do the same thing, schedule an appointment. Their websites are very helpful. I want to leave you with the fact that these slides and the sponsor codes for the competition side are on the district website, and that you'll be able to then participate and get your members who weren't on this call involved in this. So there's a lot of information here. Hopefully it can act as a leave behind for y'all. And I'm happy to also be on the Speakers Bureau, happy to talk to your club as a program about what's going on with COVID, and also the shortage of blood supply, and how to make that as simple as possible for your club. One last closing comment: we are not encouraging, social gatherings to get blood drives going with blood buses right now. We're encouraging people to send them. That's why Carter Blood Center was on there so much, because they have the most locations in DFW and all over our district, that you can go in. Literally, they'll take walk-ins. They're desperate enough to take walk-ins right now. It's better if you have an appointment, but go to your blood bank's website, schedule your appointment. All of them, I've looked at them today. All of them have places where you can schedule an appointment and get that started in your community all over the place. So not just here, but you've got a relative out in Weatherford, you've got someone in DFW, anywhere, or all over Texas. This is what needs to be happening, and it's underappreciated, underexplained. Just want to make our district aware of what's going on. So with that, I'll close.
Hey, John, I wonder if,
Yes,
I can't chime in at this point and put my public image hat on. We have 64 clubs that have Facebook pages, 61 clubs that have websites. These are
Yeah.
wonderful tools to help get that word out to
Yes.
the community. If we look at those 65 clubs, I mean, there are a number of likes and followers, ranges anywhere from 200 to 1,000. So if we just take an average of 500 times 50 clubs, we can reach out to 25,000 people. It's just a matter of putting that
Yep.
information out there and, you know, and making it site specific to your location. And I would be glad, if you've got some questions about how to do
Yeah.
that, please drop me a line, an email or a telephone, and I'd be glad to help support you and your club in getting that information out. Thanks. I just need to chime that in because John ended with, we could start immediately, and that's one way we
Yeah, and
can
it's
start work immediately.
Yeah. Well, yeah. And we all have kids and grandkids. I mean, I have kids, I don't have grandkids yet, but many of you do who maybe already had COVID. And even if you don't, I mean, there are plenty of people in your network on just outlined that can either do the blood donation or the plasma if they've been unfortunately affected by COVID. And it's really the young people who have to step up right now, and we have to really mobilize that. So.
Yeah, very good. Yes, this is so. John Courtney, if you can reach out, John, you and John Purdue get together, kind of work out some one-page presentation ads or something. Put those out on the district Facebook page. Have those shareable where we can share those on our personal pages and our club pages. Just make awareness, little 1, 2, 3 line areas about donating blood, donating plasma. Reaching out to the different organizations. Now we have in Tarrant County, I know we have Carter and the Red Cross. You said in Abilene, it is what is the name of that? The blood drive,
Meek.
Okay.
Meek Blood Center, MEEK, and they have a website that's got everything on their website as well. Yep.
Roger, I've got couple
And Wichita
questions.
Falls, it's Texas Blood Institute.
Roger, I'm looking at the chat questions. Janelle asked, do blood centers check the antibodies when one goes to donate in order to determine whether you should give plasma or just blood? I guess it's a question for you, John Purdue.
Yeah, great question. Can you hear me all right?
Yes.
Make sure you can hear me. Okay, great. I'm glad you raised that question because I meant to notify everyone that I know Carter at least will do a free screening for antibodies to see if you've had the virus when you do donate. So yeah, they will ask you questions, you know, if you've had a positive COVID test or anything like that, to screen you for the plasma donation. But I guess the good news is that if you're willing to give blood, you can also go and, you know, once you schedule your appointment, you could always just give whole blood rather than the plasma. But yes, they will do a thorough screening as a blood donation. I don't know if that helps, but they will remind you. If they find you, they're going to remind you because again, they're only supplying about half of what the hospitals are demanding right now for the plasma.
Can I ask a follow-up question to that to be sure I understand? John?
Yeah.
Okay. I've given blood and
yes.
So, but if they test after you've given, then you have to wait till next time to give plasma, I think. That's a question. Or the other side of that is do they check for antibodies before one gives so they'll know whether to do plasma or just whole blood? Does that make sense?
Yeah, it does. And it's probably beyond my expertise because each blood center is a little different, but I would say that they will, if they screen you and they're clear that you've already had a COVID test and positive, have already 14 days, you have to be at least 2 weeks past your COVID negative test to get to donate plasma. But if you don't know that you had it and you may have already had it, I believe they will let you donate blood, but they will probably let you know next time that you have the antibodies because they're going to have to go back to the lab with that product to find out if you've got antibodies. So they won't do plasma unless you've got certain prerequisites, but they are very desperate, so they're going to work with you when you schedule your appointment. I put the phone numbers on the slides for all the blood centers. I would make before if you have those kind of questions to your local blood center, the expert, but I'm not a scientist.
I could just ask when I go because I go pretty regularly. So, okay, thank you.
I want to jump in right here. This just happened to me. I didn't know I had COVID. And then after I donated blood, got a positive antibody test. So when I was sick, that's what I had, even though I had a negative COVID test. But so they were going to allow me to donate plasma 15 days after I donated whole blood. So I got my test 3 or 4 days after my donation. I called and set up an appointment. They only made me wait 15 days to do that, even though I had donated whole blood. So I didn't have to wait the full 8 weeks to donate plasma for the first time.
Yes.
So that helps a little bit, I guess.
And we have another.
John, we have another question from Don Hicks.
Yeah, and
Hello? Yeah, anyways, he asked a good question, and you were going to cover it in your slides, and that was one of the ones we missed. What can people do who, for whatever reason, can't donate? To help, help get the word out.
Those are the people that, because you're, can you hear me all right?
Now we can.
Okay. So yeah. Okay. All right. Technology. Honestly, if you cannot donate, I would let that be an impetus for you to be even more active in your recruiting, given that it doesn't take, you're only able to donate 1 unit, but think of all the people in your community and, center of influence that you were able to spread the word about this. I think it's challenging. This is definitely not an easy goal for Rotarians to execute on, but the most important thing is that social media is definitely one thing, but making it safe, making people trust the system and feel safe about donation is going to take a phone call. So call it 5 phone calls a week, to people that about blood donation that are healthy and able to donate. Put a goal for yourself and for your club, and so that you don't let it kind of get to be this big thing that overwhelms everyone who can't donate. There are our club is a very, we have more senior folks in our club. They've been donors for years. They don't anymore for various reasons. We, Fort Worth South is trying to recruit donors for these types of things. So I want to make it's not just about you as a Rotarian. And in the slide I had one called Earn Your Fangs. Well, you can be a vampire without being able to donate. So Chuck Kurtzman's a classic example of that.
Well, that was all the chat questions we had. I think Roger's back on. We lost him for a while. Roger, are you connected? Apparently not. So
hey, there we go. There we
you go. Okay.
Yeah, sorry about that, guys.
Well, we completed all the chat questions, and we're ready to do whatever you had planned next. And I think you were going to do a wrap up, right?
Yeah, we're just going to wrap this up. I really appreciate everybody being here today. I like to keep this at 45 minutes, that's where we're at. So thank you so much. We'll be back on next month. We may be next month continuing this conversation regarding COVID relief and our blood drives. So please be aware of that. And thank you all for being here. Welcome to 2021. We're going to make this thing happen, aren't we? So thank you so much.